Hi, I'm Mike Baker. Today I'm going to demonstrate how to program and operate the MTI oral surgery chairs, models 721, 710, and 705. A full account of what I talk about is also found on page 10 of the user manual. These models can come with a hand or foot control. Both controls are virtually the same. You have your manually positioning, your lift, your back section, your tilt. Please note the 705 does not have a tilt function. You also have your home button, your swivel button. In case your chair is equipped with swivel, you push that button and it'll swivel for 6 seconds. Your stop button, and you have 3 programs. In order to program, put your position in the desired position, push enter, and choose your program, program 1. Now that's programmed. These models have various headrests available. To operate, you can extend the headrest by loosening the knob on the backrest for a taller patient. Tighten it down. You can articulate the headrest on the bottom or the top. Simply loosen it, put it where you want, and tighten down and it will articulate. For a shorter patient, you can bring the headrest all the way down. Another model headrest that's popular is the prosthetic headrest. The difference in this being that it has another bar for articulation and another lock for locking the articulation of the headrest itself. This one can go further down. On the headrest lock, you can make it very tight so it doesn't move at all. You can loosen it so it has some kind of movement, or you can have it totally loose. So you can kind of put that wherever you want as far as, and you can also move the knob if it's in your way by pulling out, moving it, and letting go. If these models come with forum sports, they plug in the headrest on both sides and they have a detent in it, so it'll click and stay, and then you can use the headrest. The 721 has 2 ways to attach arms and various arms. They can attach on a floating arm mechanism, or they can also attach on a seat rail. This arm is called the patient arm on a seat rail. This arm can raise and lower. It can also go back and forth. Most people do point it in the backward position, but some people also point it forwards. Another arm is an IV arm. To attach an IV arm, you want to hold the arm with one hand and guide it with the other hand. On the rail, you want to roll it onto the rail and it'll slide on. And then you tighten it down. The second way to attach arms on a 721 is with the floating arm mechanism as shown here. This is a floating patient arm. The advantage of floating arms is as the back goes down or the back comes up, the arm stays with the patient, so you don't have to readjust the arms as you do on a seat rail mount system. This is the patient arm. With the patient arm, you can unlock it, you can raise it higher, you can lower it, and you can also swing it out when the patient's exiting the chair. Another type of arm that attaches is what's called an IV arm. To insert an arm, what you want to do is support the armrest with one hand and guide it with the other hand. You want to make sure the arm is parallel with the ground and the arm is aligned. To remove, you simply push the tab in and remove straight. So again, you want to make sure the alignment is correct or you will be fighting against the arm and getting the arm in. Now, a difference between an IV arm and a patient arm is that this arm can articulate. I can unlock the lock, articulate it to wherever I want, and lock it back down. I can also loosen this lock and raise and lower the arm as well. All arms in the 721 do come standard with restraint straps. They are Velcro, and they also have 3 different locations where you can snap them into place. In addition to the standard IV arm as shown before, this is also available, which is called the deluxe IV arm. The advantage of deluxe is you can unlock and lock the arm with one hand. For maintenance, we suggest you lubricate your pins and joints with lithium grease. For cleaning, please refer to the MTI recommendation letter for cleaning that came with your chair. If you have any additional questions, please call our technical support at 801-875-4990 or email them at technical.support@mti.net. Thank you.